I've got Chrissa McFarlane here. She is the founder and CEO of Patientory. Welcome, Chrissa.
Thank you for having me.
Nice to meet you. Tell us a little bit about Patientory.
So Patientory is a health transformer company, and we are focused on empowering end users with actionable insights to their health data to improve their health outcomes on a daily basis, cutting the cost of healthcare to zero.
Very cool. Now, doing a little bit of research about your company, you guys are utilizing some very, interesting technology, specifically cryptocurrency and blockchain. Can you explain kind of how that integrates into your platform?
Yeah, so Patientory is actually one of the founded member companies of the P2Net HIPAA-compliant blockchain decentralized storage network. And I know that was a handful, but essentially we're utilizing blockchain with our decentralized storage system to securely store and manage the transfer of private health data. So we are actually one of the consortium members of that ecosystem, and we're able to build our decentralized application software on top of this network to enable more insights into clinical health data.
Very cool. So I know yesterday, I think one of our speakers kind of gave a very quick definition of what is blockchain. Can you kind of give a really quick summary for those who don't understand what is blockchain and how specifically does it apply to me as a patient?
Absolutely. Well, as you know, blockchain is used in many different industries. The basic definition of blockchain is a ledger, which basically builds on transactions. It's immutable, so it's able to really track transactions over time. In regards to healthcare and how Patientory uses blockchain, we use it as a form of transactions for health data management. So patients like yourself, we've built an app on top of this network where you're able to create a longitudinal healthcare record of all your health data over time.
And the advantage is that, does it make it more secure, faster, easier to access?
Well, today electronic medical records are siloed. They're legacy infrastructure that don't want to share. They're walled gardens, so to speak. So by creating this blockchain network, we actually integrate into the major electronic medical records. So regardless of what hospital or clinician you see, you're still able to have quick access to your data.
Nice. The other kind of Silicon Valley buzzword that I came across reading about your company was cryptocurrency. You mentioned P2.
Yes.
How does that fit into your platform exactly?
Yeah, we're actually the world's first healthcare cryptocurrency. We launched P2 in 2017 through a token sale, and that the currency on the platform actually regulates the amount of available space at any given time on our blockchain network.
Interesting. Okay, meaning more space, more room for health records and health data?
Yeah, but also it verifies the transaction. So, in order to start to store more data on the blockchain, you need to verify that with our cryptocurrency token.
Got it.
So it's more of a self-governing blockchain system.
Mm-hmm. And how does your platform, how does it enable patients and providers to just be better connected with each other and to their overall community?
Yeah, so that's the software we build on top of this network. We find, data being that underlying piece that's really going to connect everyone. Our software, which we provide for enterprises, care providers, and the app for patients and consumers, will then have more meaningful care coordination workflows. So doctors are, employing better insights and management of their patient populations. They're able to predict, certain instances of when, let's say, a patient might return into the hospital and, be able to manage that much faster.
Awesome. Well, thank you so much, Chrissa. It was nice to meet you.
Nice to meet you. Thanks again for having me.
Yeah, absolutely.